Dr. Greg here, team dentist for the BC Lions. We're at the Pacific Dental Conference 2026 talking about sports dentistry.
I've been a dentist for the Calgary Flames now for almost 28 years.
Team dentist for BC Lions for the last 30 years, so this is a bonus.
I love sports. I can't imagine having life without sports, and of course dentistry is fun for me.
I graduated in 1995, and the next year I joined the Academy for Sports Dentistry, so I've been now a member for 30 years, and I've been held different board positions, including president on 2 occasions, and now I'm the historian.
Right now I work with the CFL Hamilton Tiger Cats. I work with the OHL, the Ontario Hockey League, the Brantford Bulldogs, and I work with the National Lacrosse League team, the Toronto Rock.
I've been a sports dentist since the year 2005, and I got involved with hearing about the Academy of Sports Dentistry in the United States. I joined that, became a member, became a certified dentist, sports dentist, and my goal was to help out the skiers because my passion is alpine skiing. And I then approached the Canadian ski team and got involved with them and helped with their athletes and all the way down to the provincial level and the club level as well.
There happened to be a professional basketball team coming to my area, and I thought, you know what, I'm going to give them a call and see if they have a team dentist, and if not, maybe I can join them. That's the Vancouver Bandits, which are now in Langley.
Every dentist is a sports dentist because we all see trauma. It's something that definitely we want to know how to incorporate into our practice, and so it doesn't throw us off for the rest of the day either. So whether you're working with a team or whether you're just treating trauma, it's all kind of part and parcel of the same thing.
We have a great group of individuals that want to help and give back. It's not something that you go and make a ton of money for. It's about passion, and it's really nice to have like-minded individuals that also want to help.
Now, when I first started, so I was young, I was like 23 years old, and I joined a practice. Luckily, I had a mentor, right? Because 28 years ago, there weren't the structured workshops that are available now, like through the Academy for Sports Dentistry. So back then, for me, it was all on-the-job training. But now, luckily, there are trainings, right? There's training workshops that you can attend, and then there's more mentors around.
Being involved in sports dentistry is just a lot of fun. You help the athletes achieve their greatest results, whether it be making great mouth guards, repairing their teeth so that they aren't in pain and look good, and also in case of emergencies you can deal with it. We're there to protect the man or the woman behind the helmet.
The thing is, we're always looking for prevention first. So we want to try to get to know the athletes at the beginning before an injury happens, get them fitted for a custom mouth guard to protect their teeth, and also, should there be any situations where there is trauma, act quickly.
Obviously, we know that mouth guards provide safety is to do your job. It does reduce concussions and brain trauma, and obviously it helps protect your teeth. While I was a skeptic during my playing careers, I never wore one in high school or college. It was very restrictive. It wasn't comfortable. It was hard for me to communicate to my teammates and actually catch a extra bit of air, and I was very skeptical until I met Dr. Chang. Dr. Chang convinced me that he could customize one to my specifics that would allow me to do my job at a high level while maintaining comfort, and he actually did that, and I'm a big proponent of mouth guards ever since I met Dr. Chang. I now work as president of the CFLPA, and one of the things that we've done is mandated mouth guards for all our athletes.
It's shocking to see how many clinicians don't know much about traumatic injuries. It's something that I believe most clinicians should learn about. The other flip side of it is how many performance helpers that a clinician with the skill set to do this kind of work could learn. So every day I continue to learn about things that can help athletes do better. And And I'm testing everything on my own with my daughter and family because I'm like, oh, well, if it could work for an Olympian, maybe it could work for me.
We only think about the coach, getting the best coach to teach you, to guide you to hopefully the Olympics and having beating your personal best, or the gym off-ice trainer. That those are probably your most, the first few that come to mind. But a medical team, you don't think you need them until you do need them, and then it's too late, right? So you want to have a good network of friends and doctors who, not just in Vancouver, for example, I look for having a network across the country, because as athletes we travel all over for camps, for competitions, for working with different coaches across the country. So it's really important to have someone available in the network to be there to support you at all times.
But when you get back to your office, you never know what your first patient's going to be. It could be a dental injury, whether it's someone that slipped and fell walking into a store or fell on the ice, or whether it was an accident. And there are more and more people playing sports at the recreational sports are even more important probably, because those people never think of doing anything. Nothing's going to happen to me. They won't wear mouth guards. They're drinking sports drinks, which are bad for their teeth. They're chewing tobacco, which is not good, it causes oral cancer. And so we need to educate not just our elite athletes, not just our amateur athletes, but all our patients, because you never know what they could be doing in sports.
We definitely want to make sure we're kind of looking at it holistically. We don't want to just treat their mouth. And a lot of what I like to do is the performance aspect, and use what we're doing dentally to help with their posture and their flexibility, and making sure that they understand too that it's a nutrition aspect. The mouth is obviously the gateway to our whole body. So we want to make sure that we teach our athletes and our patients that everything is connected.
If you're taking good care of your teeth, you have a good diet, then your overall health will be good, and hopefully it'll cause good performance. So it's so important for us dentists to encourage this, especially in kids, to have healthy athletes at 25. You have to have healthy kids at 10. So encouraging that as sports dentists, making sure they eat the right things from a nutrition standpoint will give you better teeth and overall health.
Because sometimes, they are busy being athletes, right? And so, ultimately, as a dentist, right, I'm always talking to people about their oral health and about, regular maintenance for them. Particularly for me, I like to talk to players about inflammation, right? Gingivitis is an inflammatory disease, and we know that inflammation travels throughout the body, and we know that inflammation influences performance, not just from a body perspective, from a brain perspective. So for me, that's usually how I can instill oral hygiene and health with the players, is really linking it to performance.
You're healthy in all parts of your body, you're going to perform better as an athlete, regardless what the athletic endeavor is.
I was a cross-country mountain biker. My sport doesn't really support wearing a mouth guard because the races are between an hour and a half to 2 hours, and there's this whole theory about affecting your breathing. However, I think today, with the way technology is coming and how mouth guards are really advancing with the different types of materials, I certainly think that there is room for that. And there are traumas to the head and neck all the time with mountain biking. When people fall, they go over the handlebars, and the first thing that hits the ground is their face. So I definitely think that there's an area. Maybe I need to develop something.
I see players that I used to see back in the day, now they're the GMs of our company, right? Or players' kids are playing. And so ultimately it's about the connection really with others that really just keeps me coming back, and the connection with the medical team that we work for. Because ultimately, there's no I in team. I work with a team, we all work together. It's just not all about me and the glamour.
My goal right now is to try to encourage female dentists to come in and get the training that they need to feel confident, whether it's in the locker room, on a court, on a field, so that they can be a part of all of this. Why I love working with the group of people I work with is because they realize that it's a group effort. We need to make sure that all bases are covered to help the athlete, and to make sure that if we can't get the prevention part underway, we can at least treat them properly.
You know, it's a great organization. It's a really nice way to, especially if you've played sports in the past and had a chance to be involved in sports and love sports, it's a way now as a kind of an older, less active, less high performing athlete, you know, it's a nice way to still stay involved with it. So it's a really nice opportunity to see other athletes, help them develop, and as I say, I like the performance part of it, to help them improve their own performance and optimize their physiology, to let them recognize, you know, what they're really capable of. It's amazing that we can see some of these improvements just with things that we're doing from a dental perspective.